All right, now we're going to learn how to give an IV push med like Lasix. It's not hung as an IV piggyback or secondary or antibiotic or anything. It's just pushed into the Y site in the IV, all right? You have to look the drug up in your Davis drug book and know how many minutes to push it over. If you push it too fast, it can cause things like cardiovascular collapse, where the heart and everything just collapses. So LPNs can give very few IV push medications. You cannot give any IV push medications at Forest City Hospital. They will not allow LPNs to do it. Years back, when the state board said we should start teaching this, the faculties that were present then on the LPN faculty panel chose certain IV push meds to teach their students. Of course, I think I'm the only one left now. But in your IV workshop syllabus, you have a list of IV push meds that we will show you how to push. We're not going to show you each med, but it tells you the med, it tells you what to watch for, how many minutes to push it over, whether or not you have to dilute it or not, and that's all in your Davis drug book, okay? So you also always have to know whether or not when you pull the medicine up, do you have to dilute it with normal saline or distilled water. The medication we're going to push is Lasix because it's the most commonly pushed medication. If you push it too fast, you can cause the patient to go deaf. And I can't tell you how many nurses I've seen walk in, push it, and walk out. No, Lasix has to be pushed over 1 to 2 minutes. So when you get ready to push the medicine, you look at your watch, at your second hand, and every 15 seconds, you push a little bit of medicine until 2 minutes have gone by, okay? Now, I may not do 2 minutes in this video, but you would push it over 2 minutes. It's called slow IV push, SIVP, all right? So Lasix, you have to draw it up. It comes in a multi-vial amp. You have to pay attention to what the doctor's order is. Typically in your Lasix ampules, it will be 10 milligrams of Lasix per 1 cc, and that's what we have here. So we're going to draw it up. We don't need gloves. We're not touching body fluids. Remember to draw out of an ampule, even if you pop the top off. What do we have to do? Right, we have to wipe it 10 times by new CDC guidelines. All right, to draw medication out of this isn't an ampule, it's a vial. Okay, it's a vial. You have to inject the amount of air that you want for your medicine. So it's 10 milligrams per cc. Let's say the doctor wants us to give 20 milligrams. So we're going to pull up 2 cc's. So we're going to inject how much air? Right, 2 cc's of air. Don't have your needle too high, or you'll pull air. All right. We would have to label this syringe because we cannot go down the hall with a syringe unlabeled, and we have to cover it. All right. We go in the patient's room, and the patient has IV fluids hanging. Do you see that? So we're going to push this medication in the Y site now that's closest to the insertion site of the IV needle. IV piggybacks go above the pump, but IV push meds go in the Y site closest to where the IV enters the patient. We have to wipe it 10 times. All right, these are needleless entry. So we left the needle on to protect the end of the syringe, but if you pierce one of these with a needle, you have ruined it. And all of this has to be changed, okay? So now, we're going to screw this down. You just push it in, and it's going to pop back. Look at that little blue circle. It's kind of like a spring. It's going to pop back. So you have to push and twist at the same time. Twist it down until it won't twist anymore. And then you want to get your watch, and I'm going to take it off and put it where you can see it. I hope you can see my second hand. Okay? And every 15 seconds, you're going to push. But when you push, you have to clamp off the IV tubing above the Y site. If you don't clamp this off, when you push the Lasix in, it's going to go to the area of least resistance, and instead of going into the patient, it's going to go up the tubing. So you have to clamp it. So, okay? I don't want to, let's move the watch over here so I don't block it for you. All right. So we'll wait till it gets straight up, so for video purposes, so that it's easy for you to see. All right, here we go. We're going to clamp the tubing and push just a little. Then unclamp the tubing or your IV's going to start beeping. Then 15 seconds will be when the second hand gets to 3. Clamp your tubing, push a little. Unclamp the tubing. And every 15 seconds, you're going to push just a little until you have taken 2 minutes to push this in. All right? Push, push, unclamp. We're coming up on just 45 seconds. Clamp your tubing, push just a little, unclamp. Coming up on 1 minute. Clamp your tubing, push, unclamp. And I would do that same process for another minute, and at the end of the minute, I will have injected all the IV push Lasix, okay? And that's how you do IV push through an IV line with fluid, all right? All right. I'm finished. When I say that's how you do it, cut it.
Okay.
Stop it.
Okay, and say that's how you do it. That'll be your sign.
That's my sign to stop that stuff.
Here's your sign. Okay. It was 7 minutes.